it from there.
Hello. There's lots of people.
Oh, that's all, yeah. Hi, everyone. We will start in a moment. Laura and I were just thinking, are we actually going to have any attendees? But here we are.
Not a problem.
Cool. I don't know, LJ, what you think, whether we just leave as, do we leave for the talk? I can make everyone panelists, or maybe we just leave like this in case.
I think leave like that, because I think people have got access to the chat, haven't they? So that's okay. They can pipe up during.
Cool. And so let's just give it a couple of minutes, and then we'll make a start.
Thanks everyone for joining.
I'm lucky to be on holiday, so I'm not sat in an office like LJ.
This is my coronavirus.
Oh, it's a good one. Is it knitted? Oh.
Okay. Oh, good. We've got a few. That's excellent. Okay, great. Well, I think some people might be stragglers, and that's okay. So if people join a bit later, that's fine, but I think maybe we'll just get started. So thank you so much, everyone, for joining us. This is King's first ever No Meat May, and we're very excited to be bringing you some events. This came about as part of our focus on sustainability. So King's will be launching its official green plan very soon. And so there's a focus on all sorts of areas of different aspects of healthcare and sustainability. So look out for lots of things coming up, and that's been co-created with staff. And one of the things Shireen and I are really keen that we include as part of that is about our dietary choices, and that's both staff and patients, and what we're providing on site, and what conversations we're having in relation to health, diet and sustainability. So part of the point of No Meat May is to get you all thinking and talking about that, and we're already having some really great conversations, so keep them coming. Do join the WhatsApp group. There's some nice chat and some great recommendations for various things coming up. But today Shireen's going to give a really brilliant introduction, I'm sure, because I've seen her talk before about the how and why of a plant-based diet. So we are both plant-based. That means no meat, no dairy, no eggs, and we've made those choices for evidence-based reasons, and we're hoping to share some of that with you today. So I'll hand over to Shireen.
Wonderful, thank you. Welcome everyone. It's really great to be here. It's been a long time coming. I didn't think I would be talking to staff at King's College Hospital about ditching meat or adopting a plant-based diet, so feel very privileged to be able to talk to you today. So just a couple of housekeeping things. If you want to ask a question, pop them in the Q&A function. If you just want to chat amongst yourself, use the chat function, but LJ and I will keep an eye on the Q&A function for afterwards, and hopefully there'll be plenty of time for questions. I've scheduled it till 7, so we'll go if there's enough questions, otherwise we'll finish earlier than that. So I'm just going to share my slides. So just make this full. Great, so what I'm going to talk to you about today is why and how to transition to a healthy plant-based diet, and really focusing on the human health aspect, but I will be touching upon some other reasons why we might want to adopt a plant-based diet. So I'm going to talk to you about why plant-based now, the evidence supporting plant-based diets for prevention and treatment of chronic disease, the international consensus on diet, nutrition and health, a small overview of the bigger picture, which LJ will speak to a bit more on the 20th of May, and then a few top tips for making the switch. And I'm hoping that the Q&A can focus on the practical aspects of adopting a healthy plant-based diet. So I think it's always good to disclose one's own diet pattern when you're talking about diet. And as LJ said, I've been vegan for more than 7 years. I became vegan for animal justice reasons, but also now advocate for health and environmental reasons too. And outside my work as at King's, where I work as a consultant hematologist, I spend all my free time providing education and advocacy on plant-based diets through my community interest company called Plant-Based Health Professionals UK. And more recently, we've launched a lifestyle medicine service called Plant-Based Health Online. So you can check out that information if you want to from the links given. And I'm also employed by Winchester University, where I provide the UK's only CPD accredited course for health professionals on plant-based nutrition. And that's fully online, so anyone can take that if you want to. And I've put my passion into further education as well, and I'm a certified lifestyle medicine physician. So it's always good to just clarify what we're talking about. And, you know, the term plant-based diet can be confusing. So just to clarify what we mean by these various terms, because you see them used fairly interchangeably when you're reading scientific papers and articles. So for me, the word vegan is not really a diet pattern. It is a social justice movement, which also incorporates a diet change, but it centers animals at its core. And a vegan diet tells me what somebody is not eating. So you're not eating meat, dairy, eggs, fish, honey, for example. Vegetarians don't eat flesh, but they continue to eat dairy and eggs. The term flexitarian is used a bit more, and it's usually in relation to people who are adopting a more sustainable diet due to environmental concerns, so are drastically cutting down their meat and maybe having meat and dairy-free days, but are still eating small amounts, and it's not got a defined definition. Now, the term whole food plant-based is what I like to use to describe a healthy vegan diet. And it's not just what I like to use, it's the kind of term used to define a healthy plant-based diet without all the other connotations of veganism. And you can see in the plate depicted here, which I'll talk to again a bit later, about what the main components of a whole food plant-based diet are in equal proportions, although not always at the same time: fruits, vegetables, whole grains and legumes, meaning beans, peas, chickpeas and peanuts, etc. And then the term sort of predominantly plant-based has come into terminology. And for me, that sort of means when somebody is sort of 85 to 90% plant-based, and we'll come back to that again. So I suspect I'm speaking mostly to health professionals, so you know this already, but the majority, so 90% of deaths are caused by non-communicable diseases, and this is UK data here. And the top causes of death and disability are cardiovascular disease and cancer. And 5 main risk factors account for 80% of these illnesses: unhealthy diets, tobacco smoking, alcohol consumption, lack of physical activity, and something that I know LJ is passionate about, air pollution. Now, 4 of these 5 risk factors, we actually can make choices and change our lifestyle habits to try and improve. And today we're going to focus on the unhealthy diet aspect and how we might improve this. Thinking about premature causes of death in the UK under the age of 75 years, it's cancer that tops the list here, 42%, followed by cardiovascular disease, 22%. So just keep this in mind when we talk about the reductions in death from these 2 diseases by adopting a healthy diet. So there's great data on the Global Burden of Disease Study Group website, where you can find the top risk factors for death and disability. And again, this is UK data. And when you look at the top 10 risk factors, at least 5 of them relate to our diet. So a high fasting glucose, high BMI, dietary risks is given its own category, but it's interrelated with these risk factors: high blood pressure and high LDL cholesterol. And I accept that we cannot live forever, and maybe it's not desirable to, but whilst life expectancy has been slowly increasing, although more recently plateauing, so, you know, as a woman in the UK, we can expect to live to nearly 83 years and a man 79 years, healthy life expectancy is pretty shocking. It's only 68.9 years. So we're spending 12 years at the end of our life in ill health. And I think none of us would want this for ourselves or our families. And one of the major problems or reasons why we are in ill health is our unhealthy diet. So these data published back in 2019 made the headlines. 1 in 5 deaths globally, and including in the UK, are caused by an unhealthy diet. So what is the definition of this unhealthy diet? Well, the risk factors they found in this study were as follows. I've just listed the top 5, but diets high in sodium, which sadly is a reflection of our pre-prepared and packaged food consumption. But then following that, it's because our diet is too low in whole plant foods, too low in whole grains, fruits, vegetables, nuts and seeds. And this is because these are the only foods that have been associated with promoting health and well-being. And again, the main causes of death due to an unhealthy diet are cardiovascular disease, cancer, and type 2 diabetes. Globally, this amounts to 11 million deaths per year. And remember this figure because we'll come back to it again at the end. We have a particular problem in the UK where more than 50% of the food we buy in supermarkets is classified as ultra processed, not even processed, but ultra processed, so far removed from the original ingredients, with additives, preservatives that are not good for health, and cooking methods that are also suboptimal. And so what has been described by the Global Burden of Disease Study Group is this quiet pandemic in the background of high blood pressure, high blood glucose, and obesity and overweight, leading to weakened immune system, increased susceptibility to infection, and raising our risk of inflammation. And at the cause of every chronic disease is low-grade inflammation. And this issue has been highlighted for the last year in this COVID-19 pandemic. One of the many lessons we've learned is the vulnerability of the UK public due to the underlying health conditions. So pretty early in the pandemic, July last year, we were realizing that those that were suffering the worst consequences were metabolically unwell, overweight, heart disease, cancers, type 2 diabetes. And just recently, a huge analysis from over 1 million admissions to hospital in the US. And what they found in this analysis was that 60% of hospital admissions for COVID-19 were attributable to just 4 conditions: hypertension, heart failure, obesity, and type 2 diabetes. And these conditions are intimately related to our diet and also other lifestyle habits. So what's the solution? Well, rather late in my medical career, I've realized that there is a solution to this, and it's one that's not focused on enough. It is our lifestyle habits. And unfortunately, we've had to make this into a medical discipline called lifestyle medicine. And here in the UK, it's championed by the British Society of Lifestyle Medicine, where we address in clinical practice the 6 main drivers of chronic illness: nutrition, physical activity, avoiding toxic substances, promoting healthy relationships, working on restorative sleep, and managing stress. And together, these could wipe out the majority of our chronic illness. And for me, most passionate about diet and nutrition. So the American College of Lifestyle Medicine has put out a position statement on what they classify as the optimal diet to prevent and reverse chronic illness. And it's the definition essentially of a whole food plant-based diet. It's a diet plan predominantly on a variety of minimally processed fruits, vegetables, whole grains, legumes, nuts and seeds. And that's the plate I showed you right at the beginning. This is because we know the foods that cause chronic illness. We've known for decades that it's unhealthy to consume a diet that's high in refined carbohydrates, so white sugar, white flour, baked goods, etc. Fried foods also not good. Sugar sweetened beverages, red and processed meats have no place in the diet. Processed red meat was classified as a group 1 carcinogen in 2015 by the WHO, and red meat as a probable group 2 carcinogen. Really no dietary requirements at all, and given the impact on the environment, it's a no-no for me. Saturated fat, predominantly found in animal-derived foods, is a real driver of cardiovascular disease and inflammation and abnormal gut microbiome. And sorry to say that really alcohol remains a toxin and a carcinogen and has very little place in a healthy diet. So what do we know about foods that support health? Well, they're here. It's a variety of colourful fruits and vegetables. It's beans and legumes and pulses as your main source of protein, and it comes packaged with fibre rather than coming packaged with saturated fat. It's focusing on the micronutrients, the vitamins, the minerals, the antioxidants, the anti-inflammatory compounds that you find in whole plant foods. It's about increasing fibre. It's shocking to think that the UK public on average consume 18 grams of fibre a day when we should be aiming for 30 grams or more. It's adding lots of herbs and spices because they top the chart when it comes to anti-inflammatory and antioxidant properties, and of course they add flavor and taste to our food as well. It's mainly water for thirst, but tea and coffee can be healthy if it suits you, so I have no problem with that. And again, you know, vitamin D has come into the limelight in the pandemic and during lockdown. It's really crucial. We think of it as a vitamin, it's really a hormone, and if you're not getting enough sunlight, you're best taking it as a supplement. And the reason that we're in this problem with chronic disease is because of the unhealthy diet resulting in the following pathogenic mechanisms that then give rise to chronic illness. So an unhealthy diet will cause insulin resistance, oxidative stress, inflammation, an unhealthy gut microbiome. It'll cause elevations in estrogen and insulin-like growth factor that drive cancer and other issues. Your diet can alter gene expression favorably or unfavorably, and an unhealthy diet will shorten your telomeres, whereas we know that a healthy diet full of all those healthy plant foods can actually lengthen the caps of the chromosomes, the telomeres. So I could put the reverse of all this if I put plant-based diet in the middle. It addresses all these key pathogenic mechanisms of chronic illness. So we're back to what we should be eating, because these are the only foods that have been associated with good health. So we're back to eating equal proportions, as I say, not at all the same time, but in general, equal proportions of fruits, vegetables, whole grains rather than refined grains, and legumes, which are beans, pulses, chickpeas, peas, etc., lentils. Small portion of nuts and seeds in a day, and a small portion being a handful, about 30 grams, and again, water for thirst, tea and coffee if you enjoy it. And just to summarize a quote from one of my favorite public health physicians in the US, people are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food. And sadly, that is the situation we find ourselves in. Because we have overwhelming evidence from decades of research that support healthy plant-based diets to promote health and well-being, both physical and mental health. And they range from observational all the way through to randomized studies, systematic reviews, and they are also now getting into international consensus and guidelines, which I'll refer to at the end. Some of our most basic, straightforward, but quite powerful information about healthy diet and lifestyle comes from studying the blue zones, areas in the world that people and populations live the longest and are more likely to reach the age of 100 free of chronic illness. And I've listed these 5 regions here, and here is a centenarian pictured from Okinawa. And when researchers have studied their diet and lifestyle, what they found is 9 factors that they all share in these 5 regions of the world. And I really recommend you read the Blue Zones book by Dan Buettner, really enlightening. But when you focus in on diet, they share these similar factors. 95 to 100% plant-based. They focus on whole foods rather than processed foods, having a mixture of raw, cooked and fermented food, but definitely not processed. Beans are crucial in all these 5 blue zones. Mainly water for thirst, but it's fine to have tea and coffee. Snack on nuts, go easy on the fish, eliminate eggs, slash the sugar, reduce the dairy, retreat from meat. So this is from their website based on their research. So what about more robust studies? We get a lot of information about the impact of diet on health outcomes from following populations for a long time prospectively, and some of the most important information has come from 2 large cohort studies in the US, the Nurses Health Study and the Health Professionals Follow-up Study. And here is some data from one of their papers where 170,000 men and women followed for over 30 years, and they looked at 5 lifestyle factors, whether people had smoked, whether they're healthy weight, healthy diet, physical activity, and moderate alcohol. And healthy diet is usually scored based on the findings of food frequency questionnaires. And in this paper, they use the alternate healthy eating index, which gives you positive marks for fruits, vegetables, whole grains, unsaturated fats from plant sources, and omega-3 fats that can be from fish or plant sources. And they give negative marks for red and processed meats, sugar sweetened beverages, trans fats, which are found in processed food, but people often forget it's found in dairy and meat products as well, and salt as a reflection of eating processed foods. So what did they find after 30 years? Well, if people had the best quality diet, they could reduce their risk of dying from cancer by 30% and risk of dying from cardiovascular disease by 33%. That's just diet alone. But if you looked at all 5 healthy lifestyle factors, you could reduce your chances of dying from cancer by 65% and cardiovascular disease by 82%. And it impacted life expectancy, and this was healthy life expectancy. It's not living in chronic illness. These people lived 12 years longer if they were men, and 14 years longer if they were women, if they had all these healthy lifestyle factors. But every additional healthy lifestyle factor resulted in an incremental increase in healthy life expectancy. So what about the health of vegans? We're talking about adopting 100% plant-based diet, ideally for May and beyond if we can, because we know that all the major dietetic and nutrition associations around the world have endorsed 100% plant-based diet as being healthy for all stages of life, from birth, pregnancy, all the way to elders as well. And we have 2 large studies that have informed us extensively about the health of vegetarians and vegans. So the Adventist Health Study and the EPIC Oxford study here in the UK, called EPIC Oxford because it's run out of Oxford University. And a third of these participants are either vegetarian or vegan. And so what have we found out about vegan health over these last few decades? Well, if you look at body mass index, for example, vegans are the ones with the healthiest body mass index. And as you remove meat and dairy and eggs from the diet, you reduce your BMI, so non-vegetarian all the way through to vegan. Same with type 2 diabetes. Vegans and vegetarians have an almost 50% reduction in their risk of type 2 diabetes, with a stepwise reduction as you remove animal foods from the diet. Same with hypertension. You can virtually eliminate your risk of high blood pressure by removing animal foods from the diet, with vegans slashing their risk by 63%. And the same for cholesterol, lowest blood cholesterol levels in those who avoid all animal foods. And if you put all the data together, and this is much more than just those 2 large cohort studies, this contains about 18 different prospective studies on vegetarian and vegan health. And what you can see here is that vegetarians have at least a 25% reduction in the risk of heart disease, still the commonest cause of death in men and women globally, and vegans have a 15% reduction in risk of cancer. Now, I accept that we don't have huge amounts of study on vegan health, and also when we talk about vegan, it's not necessarily the healthy vegan diet that we're talking about, the whole food plant-based diet. So what researchers have come up with is a way of classifying the food frequency data into a plant-based dietary index, where they analyze the data and they give positive marks for healthy plant foods, so fruits, vegetables, whole grains, nuts, tea and coffee, vegetable oils, and negative marks for unhealthy plant foods, which are considered to be fruit juice, refined grains, potatoes never fare that well in these clinical studies, sugar sweetened beverages, sweets and desserts, and negative marks for every single animal food. And we've had a number of papers now published showing that if you stick to a healthy plant-based diet full of the healthy whole plant foods, you can reduce your risk of coronary heart disease by 25%, diabetes 34%, stroke 10%, renal failure 14%, and can even reduce your risk of dying from any cause. But there's a big but here, and so we have to adopt a healthy plant-based diet. An unhealthy plant-based diet, the UPDI, increases the risk of all of these problems. So it's no good jumping from an animal-based diet to a highly processed plant-based diet. So what about using plant-based diets as treatment? Well, people have been doing this for decades, and in a live talk I would ask you if you'd heard of this man. He really is the father of lifestyle medicine. He was the man that Bill Clinton went to after he had his quadruple bypass and wanted to adopt a heart-healthy diet. This is Dr. Dean Ornish, and his diet is now reimbursed by Medicare in the US as a therapeutic option for people with heart disease. And he published in The Lancet a randomized study of people with heart disease adopting a whole food plant-based diet with other lifestyle interventions. And he was able to show that you could arrest and in some cases reverse atherosclerosis. And at the same time at the Cleveland Clinic, Dr. Cordwell Esselstyn was doing the same, but he was only offering people a diet change and no other intervention. They didn't have to do exercise. They didn't have to, do any mindful exercises or anything. They just had to follow a plant-based diet. And he was able to produce images of angiograms where atherosclerosis had reversed and arteries opened up. This was after 32 months of a plant-based diet. And more recently, back in 2018, a vegan diet has been examined for its anti-inflammatory properties, because I'm sure you all know that we're now trying to combat atherosclerosis by dampening down inflammation. And as I've said, inflammation is the core of many chronic illnesses. And what did they find with a vegan diet? Well, compared to the American Heart Association diet, vegan diet was able to reduce the level of high sensitivity CRP, which is a reflection of inflammation and a risk factor for atherosclerosis, such that the authors concluded a vegan diet may be used to lower inflammation as measured by high sensitivity CRP, a key player in the development of major adverse cardiovascular events. So, I mean, to me, there's nothing to lose. Why not, reduce inflammation, reduce your risk factors for atherosclerosis? Similarly, we've had randomized study of a whole food plant-based diet in the community setting run by GPs in New Zealand for people with obesity, ischemic heart disease and type 2 diabetes. And they concluded that this program, just after 6 months, was able to significantly improve BMI, cholesterol and other risk factors. And to the best of their knowledge, this research achieved the greatest weight loss at 6 and 12 months than any other trial that did not limit energy or mandate regular exercise, because you can eat an abundant diet to fullness and not worry about portion control and calorie restriction on the whole. And we've even got studies on early stages of cancer, particularly prostate cancer. And again, it's Dean Ornish's name here again. He randomized 93 men with early stages of prostate cancer who were on a watchful waiting program. So I'm not saying this is instead of conventional. I'm saying when you're watchfully waiting for your cancer to progress, you can be doing something useful, which is adopting a whole food plant-based diet and regular physical activity and other healthy lifestyle habits. And after 1 year, he was able to show that men in the intervention group, which is here in red, had a reduction in the PSA level, whereas the control group had an elevation, as you would expect, general progression. Now, I accept these numbers are small, albeit significant statistically, but what's really important is what happens to the patients themselves. And after 2 years, over a quarter of the control group had to go on and have surgery or radiation, whereas only 5% in the lifestyle group had. And Dean Ornish was also able to show the mechanisms at play. So in peripheral blood mononuclear cells, after 3 months only, he was able to show lengthening of the telomeres. And he was able to show in repeated prostate cancer biopsy samples that gene expression changed from pre-intervention to post-intervention. And after the intervention, there was switching on of cancer suppressing genes and switching off of the cancer promoting genes. So this is pretty phenomenal just from lifestyle changes. So we finally got these recommendations into our consensus guidelines. So the American College of Cardiology, which is a chapter of the British Society for Cardiology, they now recommend a plant-based diet as key for primary prevention of cardiovascular disease. They also say Mediterranean, but they're clear that the healthy components of a Mediterranean diet are the whole plant foods. We've got the same from consensus guidelines from the College of Endocrinology. For patients with diabetes, they should obtain and strive to maintain optimal weight through a primarily plant-based meal plan. World Cancer Research Fund recommendations for cancer prevention. Eat a diet that's rich in whole grains, vegetables, fruits, and beans. That's what I described at the beginning as a whole food plant-based diet. And they've said that these recommendations are likely to reduce other non-communicable diseases. And, we've got strong evidence in the world of cardiovascular disease. And I'm not going to labour this point because I know LJ will be speaking to this on the 20th of May, but I don't think we can ignore the wider impacts of our diet choices, especially as health professionals. Our house is literally on fire. We have entered the 6th mass extinction event. This was published just last year, just at the start of the pandemic. We've got more species going extinct than at any other time in history. And the rather depressing conclusion from this paper in PNAS was, there is time, but the window of opportunity is almost closed. We must save what we can or lose the opportunity to do so forever. There is no doubt, for example, that there will be more pandemics if we continue destroying habitats and trading wildlife for human consumption as food and traditional medicines. It is something that humanity cannot permit, as it may be a tipping point for the collapse of civilization. What is at stake is the fate of humanity and most living species. Future generations deserve better from us. And why I labour this point is because animal agriculture contributes greatly to all of this harm and damage to the environment and animal habitats. Animal agriculture is a major driver of greenhouse gas emissions, more than all forms of transportation put together. It is also the leading cause of species extinction, ocean dead zones, water pollution, habitat destruction. It goes on and on. Animal agriculture is responsible for destroying more than or up to 91% of the Amazon. We cannot let this happen. And we have been called to action. BMJ, just at the end of last year, without decisive and urgent action, the climate crisis will increasingly undermine human health and disrupt healthcare delivery. There are both moral and practical reasons for health professionals to be at the forefront of this climate action. And ditching meat from your diet is one of the most impactful actions you can take on a personal level. And what myself and my organization and members like LJ have been trying to highlight during this pandemic is that we need to be advocating loudly and clearly about this, that future pandemics are predicted to happen if we do not change our food system. We are already seeing outbreaks of bird flu, which is predicted to be the next global pandemic. And these bird flus, when they do jump to humans, have a much higher case fatality rate than coronavirus. And we need to change the food system. I hope I have described to you how the current food system is neither healthy or nutritious and is not helping us prevent chronic illness. So this is not just information coming from one source. We had the Eat Lancet Commission produce a report back in January 2019. And what this commission did was bring together 37 scientists from 16 different countries addressing health, nutrition, environment, farming, and to come up with a healthy diet that would not only sustain human health, but would allow us to keep within the planetary boundaries of the environment so that we will not overshoot the 1.5 degrees global warming that we're really on course to do. Because again, diet change is the most impactful thing. Without diet change, we are not going to meet our targets for climate change mitigation. And what they came up with this was the planetary health plate. And here is depicted what is recommended for all citizens globally. And we can easily do this in the UK. Half your plate is fruits and vegetables, this yellow section, whole grains. You've got plant sources of protein, and here in green you can see this is legumes and nuts. You've got plant sources of oil, so olive oil, canola oil, all healthy. Limit added sugar. And there's starchy vegetables here, which we can discuss later. I don't have a problem with starchy vegetables, but it's very limited here. You can see here in blue, there's dairy foods and animal source protein here in red. And if you add up that section, it's less than 13% of calories. And it's quite clear in this report that animal foods are optional. If you opt to eat them, they should be composing less than 15% of your daily calories. And when you think about that, it's less than 1 beef burger patty a week. It's less than 2 portions of poultry. It is about 3 eggs a week. And if we did this, it would not only help us mitigate climate change, it could save 11 million deaths per year. Those same 11 million that I mentioned up front that were being caused by an unhealthy diet, but these are the figures that they estimate from the Lancet Commission. And when you look at the impact of sustainable diet on the environment, at a country-based level, greenhouse gas emissions could be reduced by over 80%, worst case scenario by 50%, but that is huge, at the same time slashing premature mortality. So it really is a win-win. And countries have been taking this on board. Back in 2019, Health Canada produced its food guide. And I would ask you what's missing from this, because it's so different from what we're used to. Where is the dairy? It's gone. There is no dairy on this plate because there is no requirement for dairy in the human diet. 70% of humans are lactose intolerant. And you know, dairy is contributing greatly to environmental harm. So what it has is half the plate, fruits and vegetables, a quarter whole grains, and then you've got eat protein, and it makes clear in the guidance that you should be choosing plant protein over animal protein because it would improve your health and the health of the environment. And again, it's make water your choice of drink. So I just wanted to share some stories with you. They're personal ones from my lockdown. So this is my husband. He is a consultant hematologist. He was vegan with me for the last 3 years, but at the beginning of the pandemic, he realized that sadly he was overweight, hypertensive, and not very well. And it took a pandemic to get him into shape. So all we did was adopt a healthy plant-based diet, ditch all the processed foods, and stick with the main food groups that we talked about. And he has slashed his weight from 87 kilos to 72, brought down his blood pressure. His cholesterol on an omnivorous diet was 6.5, and now it's down to 4.2, and he's chuffed with his athletic performance too. And another story, this time from my father, who again has been vegan for 3 years with my mum. But my dad's story is long and convoluted, and he actually had a Whipple's procedure at King's back in 2004. And I'm pleased to say he's still with us, alive and well. But as you know, up to 50% of people become diabetic after a Whipple's procedure. So it's pretty amazing that it took to 14 years for him to become pre-diabetic. And so his blood tests at the GP surgery in September showed that he was pre-diabetic and had triglycerides off the scale. He essentially met criteria for metabolic syndrome. And although I was doubtful that with, a third to half of your pancreas missing, that we could do anything useful, he adopted a healthy plant-based diet, obviously supported by my mum. And, 7 months later, he's reversed his pre-diabetes, which I think is pretty phenomenal. So I do wonder how many people become diabetic after a Whipple's because they actually have insulin resistance rather than the fact that they don't have any cells in their pancreas. So just to say that a short period of time, you can really make some useful improvements in your health outcomes. And just to close by saying that our diet choices are not just about what we eat, it's a question of human justice. And I think, again, this has been brought out in the pandemic. COVID-19 was really thrown into the limelight, the conditions in which slaughterhouse workers work and meat packing plants. And these people were termed as crucial and essential in the US, which is criminal because we've now got studies to show that counties with the biggest meat packing industries had the highest rates of COVID-19 because the spread was so extensive. If we can't do it ourselves, we shouldn't ask our fellow humans to do it for us. So let's think about how you can make these healthy swaps and changes to a more plant-based diet. So I always advocate for a healthy breakfast. I think you can't go wrong with oats with a healthy plant-based milk. You know, choose one that suits you, but soya or oat milks are great choices. Add a portion of fruit and get your omega-3 fatty acids with a tablespoon of flax seeds. That sets you up really well for the day. Most of your favorite recipes, you could swap out the meat for beans. Go half and half to start with, and then slowly transition away and add lentils, beans, pulses, chickpeas, all those to all your favorite recipes, like, you know, bean chili and lentil bolognese, for example. Swap out your refined grains, you know, white rice, white flour goods, baked goods, etc. really are not good for our health. So brown rice, brown couscous, quinoa, bulgur. You know, 60% of the world's calories come from just 3 foods: maize, which is corn, wheat, and rice, you know, and we have more than 30,000 edible plants. So I think we need to like vary it out and find some new whole grains to eat. Learn to cook and make some soups and add beans. When you're having things like salads, add beans and tofu to pack more nutrients and fiber, and to fill you up, because you will be eating less calories on a plant-based diet, and some people find that they go hungry before they learn to eat a larger volume, which is of course a pleasure. Aim for 10 portions of fruits and veg a day. If you do, there's very little room on your plate or in your snack pack for very much else. And add in that portion of nuts and seeds as your snack, or sprinkle on your salad, or put on top of your stir fries or your porridge, for example. And we recently published an article in the British Journal of GPs giving some healthy tips to support your patients. And the commonest questions we get asked all the time are about nutrients such as calcium, iron, and iodine. And there's really simple answers to this. You know, there's calcium in all leafy greens and beans, and fortified plant milks and yogurts have plenty of calcium. Iron is better and more healthy from plant sources, and again, beans and greens, but nuts and flax seeds and dried figs, for example. If you're struggling, then cooking with iron cast cookware is really good. Add a source of vitamin C to increase the absorption, and avoid teas and coffees with your meals an hour before and an hour after, because this will limit absorption. I think we all need to know where we're getting iodine in our diet. It's not just a problem for vegans, it's a global problem. It's one of the most common micronutrient deficiencies globally, and the commonest cause of brain damage in children. We get it as a byproduct of dairy products because they add it to cow feed, and also the sanitizing equipment uses iodine, and then it leaches into the dairy. But obviously it comes from soils near the sea, and so eating sea vegetables, and if you don't do that, then you're going to need a supplement, because here in the UK, when compared to North America, we don't iodize our salt, whereas other countries have decided to iodize salt. I'm not an advocate of adding salt necessarily. We had a pre-submitted question actually about B12, and yes, the person who asked the question is correct. B12 needs to be addressed. It's not found in animal or plant foods. It's made by microorganisms, and so we make it from gut microorganisms. We used to get it by eating, you know, unwashed fruits and vegetables, you know, contaminated with soil and bugs, or drinking from streams that were not sanitized. But in our sanitized world, none of us are getting enough B12. And I can tell you, as a hematologist, I'm not seeing a load of vegans with B12 deficiency. I'm seeing omnivores predominantly. So yeah, we need to make sure we're getting enough. And on a vegan diet, I would suggest you take it as a supplement. As a Veg One tablet from the Vegan Society is a great choice, because it takes the brain power out of knowing where you're getting some of these nutrients that can be difficult to acquire. Vitamin D, global problem, not just a vegan problem. Make sure you're getting enough. Omega-3 fatty acids is always a talking point. The essential ones are found in plants, and you can get them in flax seeds, a tablespoon a day, chia seeds, hemp seeds, and about a handful or 30 grams of walnuts will give you enough short chain fatty acids. And think about ways to reduce your food bill and the effort. You know, cook from scratch, bulk buy, it's fine to use frozen and tinned fruits and vegetables, and batch cook. I do most of my cooking at the weekend, you know, store it away for the week, make up your packed lunches, etc. So, in conclusion, I hope I've presented a large body of evidence to support plant-based diets for prevention and treatment of chronic disease, and that international and our national guidelines are catching up with this evidence, and that we cannot now think about our diet pattern without considering the context of global and planetary health. So we can all do our bit to mitigate the impacts of our diet on the planet. So if you're looking for things to do, and I would suggest you perhaps do this before LJ's talk on the 20th. And in fact, I've forgotten to put Cowspiracy, but in the same series as What the Health, Seaspiracy, there's the first one called Cowspiracy. I would watch these 3 documentaries all on Netflix, and it will give you a really good overview of the impact of diet on our health and our planet, essentially. And there's some great books here. And I think, you know, in the UK, there was a lot of buzz around David Attenborough's witness statement. It was very powerful, and he clearly says at the end, one of the solutions is to adopt a plant-based diet. If anyone wants further learning, I run a course at Winchester University, fully online. You can ask LJ privately about her feedback on that. She's just taken it, and it's fully CPD accredited. And I will leave you with the most common question we're asked all the time. Where do you get your protein? Thank you. I will stop sharing and see whether we've got any questions.
Thank you so much. That was brilliant, Shireen. That was a really great tour of all vast amounts of evidence, really highlighting some of the really key facts and the fact that this is really quite mainstream now. This is in international guidelines. This is not a fringe topic. This is what we should be doing as part of healthcare, and we just need to get there quicker. And part of that is about doing it ourselves, and we're all on a journey. So it takes time to adopt these into your normal diet, and we're all kind of making our way there. I still eat too much white rice, and I'm still trying to get in more of the whole grains and switch over to more brown rice, but we're definitely getting there, all of us. So there are a couple of questions. So there's one from Robert, and he asks, although there is a reduction in cancer and ischemic heart disease risk on a plant-based diet, do we have data to show that these conditions, when they do occur, happen later in life in plant-based individuals? So I think the question is, are we just deferring this into a slightly later time point?
It's quite possible, and the data I showed from that long follow-up of the Nurses' Health Study and Health Professionals Follow-up Study certainly showed you're living longer in good health, so we're living longer without the commonest illnesses. I mean, at the end of the day, you do have to die of something, but I would suggest to you that things like atherosclerosis for sure is a diet and lifestyle related disease. You do not see this in autopsy specimens in people who have been avoiding meat and saturated fat heavy diet. So atherosclerosis, I would say you could pretty much prevent unless you're one of these individuals with a familial high cholesterol, for example. But you know, genetics predict less than 10% of your ultimate risk of chronic disease. Cancer, you know, I think we all appreciate, and myself as a cancer doctor appreciate, that it's multifactorial, and you're never going to eliminate all cancer, sadly, because there's so many factors that go into it. But what we know is from, you know, Cancer Research UK stats and globally, that 4 out of 10 could be prevented, and these are certainly the commonest ones, like colorectal cancer, where more than 50% of colorectal could be prevented. Obviously, we're familiar with lung cancer being, you know, mostly preventable, at least 80% or more preventable, and you know, breast cancer about a quarter are prevented. But no, we're never going to prevent all cancers because there's so many factors, environmental and genetics do play a part there as well, in our exposures to radiation, you know, externally, and toxins from the environment, pesticides, herbicides, all those things are less easy to control. But I think there's no doubt that diet and lifestyle allows you to live longer and healthier without illness.
That's really clear. One of the most shocking things that I sort of found as I was looking at some of this more of this data is that atherosclerosis starts in childhood, and I just found that really shocking to think that actually, you know, the diets that we're feeding really young people is already contributing to their cardiovascular risk at a really young age, and that's been shown in numerous studies. So certainly something we need to definitely be shifting as late as possible, if at all. So really interesting.
And the sad, you know, the really even shocking thing is that when women have high cholesterol in pregnancy, they increase their risk for their child through things like altered gene expression, and even autopsies that have been done in aborted fetuses you can see the streaks of fatty streaks in the aorta. So it is even more shocking. And the fact that actually your gene expression is probably dictated by the diet and lifestyle of your grandparents, you know, because you pass that on. So, you know, future generations will thank us if we adopt a healthy diet.
My responsibility. Okay, good. There's a couple more questions. So there's another one in the chat, which is a common one and which you partly addressed, but maybe we can just focus on it again. So Kate says, I was wondering about the vitamins you miss out on when not eating food that has vitamins added. I guess the sort of two bits to that, I would say that for me, I take a multivitamin, and I also take seaweed-based omega-3, just because then I don't have to worry about it, so I don't have to plan quite so much. So my diet would probably cover me for everything anyway, because I do eat a predominantly whole food, plant-based diet, so I'd probably be fine. But I like to not worry about it, so I take a multivitamin. And if you do eat a wide variety of things, there really isn't anything particularly you'll miss out on. It's only really the B12 that we kind of struggle with, as you've already said. Is that right, Shireen?
Yeah, I would agree with that. And I think, you know, the issue of lower vitamin and mineral content in diets is a general thing. You know, as I've said, our diets have shrunk down and become so much less varied than, you know, what we should be ideally. You know, you could probably name just on your fingers the kind of the plant foods that you're eating in a week. And I know I've had to make a big effort to become more varied. So yeah, and I think, you know, fortification of bread and cereals, and this is way before the plant-based movement. So I think all diet patterns suffer from lower levels of certain minerals and vitamins. They all have slightly different ones to focus on. So, you know, a Western style diet with meat and dairy, you're deficient in fiber, but also perhaps missing out on things like the omega-3 fatty acids, etc., if you're not paying due attention to them. And so there's just the handful that I talked about. Everyone needs B12, vitamin D for anyone that's not getting any sun exposure. And the jury's a bit out yet on the omega-3 fatty acids. It's a whole separate webinar. I think it's absolutely fine to get your omega-3 long chains from algae. That's where the fish get it from. But whether we all need to take it is open to debate. And I'm not even convinced we're ever going to know the answer to that question. But you do get the essential fatty acids from the nuts and seeds that I mentioned.
I think something I find really interesting is that no one ever asks you about your diet quality until you turn vegan. Suddenly everyone's really fascinated, and I think it's actually a really important thing for us all to reflect on. Well, you know, we don't think enough about the quality of our diets and what we're eating and what we're talking to our patients about, and that's a real failing of medical education, which hopefully will be addressed in the future. But certainly the sort of extra focus on our diets has many benefits, and we should use it as an opportunity to think about the quality of our diets in general, however far towards that entirely plant-based spectrum that we're heading for. So really good opportunity. There's a couple more. There's one in the Q&As which I think is really interesting. So the question is, do you observe detrimental effects from people going 100% plant-based overnight? I've seen some cases and have thought that a gradual transition would be better. However, from an ethical stance, I understand why people would not want to do this. I will just comment on this just because I had an interesting thing. When you start talking about things like this on Twitter, you suddenly get lots of people commenting, and lots of the comments are, oh, I tried plant-based, but I just, you know, my body really craved the meat. I really needed it. I just couldn't. If my body really needed these things. And it is a really common response. And it often happens in celebrities. So they sort of do it and then they feel a bit ill. And then, so I think my response to that would be, you should do it in whatever way makes sense for you. Often people do find it easier to transition gradually, and that's because we're real habit formers, humans are, and particularly with food. So we have a few recipes that we cook a lot, we buy the same things, and then we try and branch out a bit, but you know, we have our staples, particularly when we're short on time. So to develop those new habits takes a bit of time, and that's a bit easier to do gradually. But it's absolutely fine to go plant-based overnight, and there are many benefits to that. It just requires a bit more planning. So there's no reason why there will be any detrimental effects at all. We're actually transitioning to a healthier diet from what we're having as our norm. But it does require a bit more thought and planning to go into it, to do it in that one switch.
Yeah, I completely agree. And I think everyone's plant-based journey is unique to themselves, and there's no right or wrong way to do it. I became vegetarian in 2001, and it was 12 years later that I finally ditched the eggs and dairy. So there is, and I certainly wasn't brought up vegetarian or vegan, despite, you know, my Indian heritage. So I think, you know, there is no right way. And I think you do need, as LJ say, a bit of planning, some skills and education and knowledge, because, you know, if you just literally kind of convert your meat sausage to veggie sausage, and, you know, don't focus on eating healthy whole plant foods, you're probably not going to just feel great on a sort of off-the-shelf vegan diet. So you do need to acquire a bit of knowledge, skills, etc. I think the main problem people may find, or that I hear reported, is the sudden increase in fiber, because you are going to be you haven't got the gut bacteria that are used to suddenly increasing their fiber from 15 grams a day to 30 grams a day, you know, doubling your fiber. So, you know, things like bloating and excessive wind and all those sort of things. And then people get completely put off, because we all hate feeling horrible in our tummies, don't we? So, you know, I think there could be a reason to just slowly increase the beans and legumes. I mean, I'm lucky because my cultural diet is full of beans and chickpeas and lentils. So I did eat lots of that. But I know the typical British diet is not, people don't know what to even do with beans. And I think if you suddenly swapped out all your meat for beans, you might find that you get a bit of bloating and your gut bacteria make a little bit of fuss until they've adjusted. But literally a few weeks of perseverance, and that there's no reason that anyone cannot be healthy. You know, that obviously some people need some dietetic input if they've got colostomies and stomas and, you know, various nutritional needs, and if you're gluten intolerant and all those sort of things, but they are surmountable problems that have, you know, easy solutions with a bit of skills and knowledge.
We're coming up to 6:30. We've got a couple more questions, so I think it's worth continuing and carrying on. If anyone has got any other questions, please do put them in the chat. I'd be very happy to answer a few more. Kate has asked, my problem is eggs. Been vegetarian for ages, can't keep off the eggs. Any alternatives? I've sort of asked whether there's any specifics, whether it's sort of whole eggs or whether it's in baking and things, because obviously there are different options, but any immediate thoughts on the egg problem?
I think kind of the savoury side of things, like if you're looking for an omelette or a quiche or whatever, then it's kind of besan or chickpea flour that is the good alternative. And I've certainly managed to make some good kind of chickpea flour omelettes and things, you know, with some seasoning and what have you. And, you know, if you actually like that eggy sulphurous taste, then adding some black salt, isn't it, that gives
it's
you
a magic ingredient. Absolutely. Yeah. Black salt.
I haven't tried it because it's not something I feel like emulating, but you can. And then, you know, tofu scramble.
Yeah, tofu scrambles a really good switch. Really works. I mean, you do have to, things like the black salt make a big difference. A little bit of turmeric makes a big difference. So there's a few things just to tweak it, so it's not just the tofu, but that works really well as a replacement for scrambled eggs. I don't think there's really a replacement for whole eggs, as in they're just such a slightly odd thing in themselves that eating, you know, a boiled egg or a fried egg, there isn't really anything that particularly, I think.
I mean, you can actually buy these things. I think there's Just Egg. I mean, not that I've tried them, and I don't think
I've not tried Just Egg. It looks weird.
Yeah, but in baking, you know, the classic alternatives are flaxseed, you know, ratio of 1 to 3, so 3 tablespoons of water, 1 of flaxseed. It becomes all gloopy and jelly-like. Mashed up banana, apple puree. Again, chickpea flour can come in useful there. But there's so many eggless recipes out there for baked goods, if that's what you're looking for. So those would be my top tips.
It made me think a lot more when I started trying to do more vegan baking about what the eggs were actually doing in the recipe, and it's really interesting. So it makes you think more about how the recipe's working and therefore what switches might work. What I would recommend if you are doing vegan baking is definitely go by a recipe. Don't just get a normal recipe and then try and switch it out, because sometimes the quantities don't quite work, and you really, if you put the effort in, you really want a good cake or a good set of brownies. So follow a recipe to start with for sure that's definitely designed to be vegan, and you'll be far more successful. Very delicious. I love a brownie. There's one that's the tricky one. For fussy children who are now vegan and trying to adopt more whole food, would you recommend fruit and veg shakes and supplements while trying to get them to accept and eat more and try more recipes? That is a tricky one.
Yeah, it's always difficult, isn't it? And I think, you know, with children, I mean, I guess you know your children the best, and it's all about role modeling, isn't it? Because as LJ said, you know, as doctors, we should role model, you know, as parents, we should role model too, and leaving out all these wonderful plant foods for them to just, you know, grab and, you know, as they get hungry, and sort of kind of normalize it. I think, you know, the easiest ways are just to whiz up extra vegetables and beans and things in sauces, and I have no problem with smoothies as a way of increasing, you know, leafy greens and berries and all those sort of things that kids may not want to eat. I'm obviously less keen on the whole juicing side of things, but I think if your child enjoys smoothies, that's great. If in a pasta tomato sauce you want to whiz in some tofu or some vegetables or white beans, something that will go completely unnoticed, I think those are the kind of ways I would suggest. And again, you know, I guess, you know, not to have such high expectations, in that it takes us all time, and you know, and not and allow for the treat things and the things that make kids feel like they're not missing out as well. But, you know, just things like making an ice cream, you know, putting frozen banana in the freezer and adding your frozen berries and having ice cream, and that's a way of sort of increasing fruit, for example. So I think there's tricks, and I suspect if you join us for next week, and I can see Hayley Tate on the call now, she's a bit of an expert on the whole feeding your children side of things, so I'm sure she'll have some helpful tips there, and probably some recipes from her recipe book too, so come back for that next week.
The other comments really were just saying that people are really happy that this webinar is happening, which is so nice to hear. We really weren't sure what kind of response we would have, and it's great to have so many people here and to have so many people interested. So thank you so much. Do chat to your colleagues about it and invite them to the future events. People are just really keen that we talk about this in terms of diet, fitness, mental and physical well-being. So it's really great to hear. That's really music to our ears. It's going to make our days today as we leave work. And Shireen goes back to her holiday, which she has interrupted because she's so passionate about this. So thank you so much. A couple of people have asked about copies of the slides and some of the information.
Yeah, I'm really happy to. I'll be able to download the attendee list for after we finish the webinar. I'll figure out a way of doing it. For the King's folk, if you want to just quickly ping me an email or something as well, if you don't hear from me, give me till the end of the week to decompress all my slides and figure out how I'm sending it to you all. For the King's guys, just email me and I can send you the slides individually, not a problem.
Great, so I think that's probably it. I'm gonna head home and cook my very delicious, tonight I'm eating Buddha bowls, so brown rice and some tofu and various different vegetables with some spices and a few seeds sprinkled on top. So that's my dinner plan. Lovely. What's your dinner plan, Shireen?
Well, to be honest,
how are things in the Isle of Wight?
Oh, it's a different world. No, I mean, there's loads of fresh produce. I mean, obviously there's lots of farmland and animals as well, but there's lots of lovely fresh produce and Isle of Wight tomatoes. And actually my dinner sounds very similar. It's going to have tofu with a peanut butter and soy sauce with lots of fresh veggies and courgettes and cabbage and things like that, with rice noodles. I'm going for brown rice noodles.
Delicious. So yes, please, our next event is our virtual live cook along, which we're so excited about. Dr. Hayley Tate is amazing, and you'll have seen her. She's famous. She's been on Ready City Cook. I mean, very lucky to have her, and we'll be making a really amazing Mexican meal. So do have a look and prepare to get the ingredients ready in advance, and then join us and we can all share our culinary adventures. That will be great. And then I'm also doing a further webinar which we'll send information about, which will actually be at lunchtime in a couple of weeks. In the meantime, please do fill in our survey if you haven't already. I put the link in the chat again, and it's also on Kingsweb. And we're really keen, and please encourage other people you know to fill in the survey. We're really keen to get people's views and get a wide range of staff views so that it helps us to plan for the future. And join the WhatsApp group, and you can ask us any questions anytime, or just share your recipes or thoughts or questions. We'd be very happy to help out. We're really keen to just be as helpful as we can to everyone who's signed up, and thank you again so much. Have I missed anything?
No, I think that's it. And we look forward to supporting you in the month. And thanks for joining, everyone.
Thanks. Cool. Have a good evening, everybody.
Bye.
Bye.